Welcome back. ProMedica Toledo Hospital is expanding its heart care capabilities. Joining us now is Dr. Omar Kahali to explain what exactly happens inside an EP lab and how this expansion could mean faster, more advanced care for patients. Thanks for being here today.
My pleasure. Thanks for having me.
Absolutely. First of all, what is an EP lab?
It's a great question. So EP stands for electrophysiology. And what that is a lab, an operating room where we, as cardiac electrophysiologists, operate. And I like to tell patients that we are heart electricians.
Yeah.
So we deal with heart rhythm issues. And the operating room is a very high-tech room where we combine different imaging modalities and mapping modalities. So things like X-ray, ultrasound, and three-dimensional electrical anatomical mapping to identify heart rhythms within the heart in real time and to be able to precisely ablate them as well.
Okay, so you put in pacemakers and things like that?
We also put in pacemakers in the lab for patients that have slow heart rates, slow heart rhythms, and we also do treatments for fast heart rhythms, and that's what ablations are.
Okay, so yeah, when we're thinking about electrical, it seems a little like a little scary a little bit, but it works to help these patients who have heart rhythm issues. So talk a little bit about some of the conditions and some of the treatments that you would do in the lab.
So part of the reason for this fourth lab was to kind of meet the demands within our community, the ever-growing need for electrophysiology services, specifically with atrial fibrillation or AFib, which is a very common heart rhythm that people have either experienced or know somebody that has experienced.
Yeah.
Reported to be maybe 1 in 4 of us will have atrial fibrillation at some point in our lives. So the dealing with atrial fibrillation has been a challenge in terms of timely intervention. So with arrhythmias, timing matters so much. The earlier you get to these patients, the better the outcomes. So with the addition of this fourth lab, we're able to now get our patients scheduled sooner and get them to an intervention much sooner than they would have before.
Okay.
So with atrial fibrillation specifically, we are trying to get these patients in for their ablation to improve their long-term outcomes.
Yeah, are these patients of all ages? Do you take care of kids at all, or is it adults? Because when I think of AFib, I sometimes think of kids too.
No, so arrhythmias can afflict anybody of any age. We primarily deal with patients from 18 years and older, and typically atrial fibrillation are going to be seen in your patients that are 60 years or older for the most part, but it's not unusual to see patients younger than that with atrial fibrillation.
Younger than that. So you talked about ablation. What exactly is that?
Yeah.
How do you perform this?
So I always tell patients it's kind of like, think of a short circuit within your heart, and we basically cauterize that short circuit and get the heart to learn the normal rhythm. So historically, it was with open heart surgery is where you would do an ablation many years ago. But this has evolved to what's called a minimally invasive approach to ablation with little catheters that we insert from veins in the leg up to the heart. So previously, we would do ablations like cryoablation, which is freezing abnormal heart tissue, or something called radiofrequency ablation, which is burning tissue. Now, these technologies were, again, very safe, and we were doing them up till recently.
Sure.
And we still do them for certain cases, but there were certain limitations to this technology, namely when you're in the heart and you're doing ablation to try and get rid of these abnormal heart rhythms, there are certain structures within the chest that you have to be careful for, the esophagus and certain nerves in the heart. So enter this new technology called pulse field ablation, or PFA, which I've had a lot of patients come up to me and ask me, can I please have this type of ablation, because they've heard a lot about it.
Sure.
This technology doesn't use any burning or freezing for abnormal heart tissue. It actually uses electrical impulses inside the heart that's delivered in milliseconds. So the procedure has the promise of being safer than our prior ablations, but it's also much quicker and more predictable. So we're able to do more procedures within a day for our patients, and then get them off the table sooner and quicker recovery times. And patients even go home the very same day, and they feel like they can go to do their normal activities the next day.
Yeah, so the fewer side effects, things like that, and quicker recovery. It sounds like I love to see the technology develop over the years and what you all are able to do. So again, this is a fourth lab now for ProMedica. People can see their doctors and say, hey, this sounds interesting.
Yeah, absolutely.
To me, very good. Thank you so much for being here today.
Oh, it was my pleasure. Thanks for having me.
I learned a lot, that's for sure. Yeah.